Good evening, everyone, and thank you for joining us. Before we get started, I want to share a few brief housekeeping announcements. First, we would like to thank everyone who submitted questions in advance of tonight's town hall. We hope to address many of your COVID-19 vaccine questions over the next hour with our panelists. If you have additional questions or need clarification, please use the Q&A function in Zoom. And as a reminder, this is a public forum, so anything you will type is visible to others. Tonight's town hall is being recorded and streamed live on Facebook. Please feel free to share the link so that others can tune in, and we will paste the Facebook Live link to this event in the chat momentarily. And finally, a recording of tonight's event will be available on the Montgomery County YouTube page, and we will also send that link out to everyone who registered tonight once the video is uploaded. So now I will turn it over to Kristen Dynamic of the Bucks-Mont Collaborative to introduce our moderator.
Thank you so much, Kelly. Welcome all. So thank you so much to Marianne for serving as moderator tonight. Marianne Fray is Chief Executive Officer with Maternity Care Coalition. She leads the day-to-day affairs of MCC and provides leadership and setting and pursuing MCC's vision and theory of change implementation. So MCC's mission is to improve the health and well-being of pregnant women and parenting families and to enhance school readiness for children aged 0 to 3. They are committed to ensuring that parents impacted by racial and social inequities in southeastern Pennsylvania can birth with dignity, parent with autonomy, and raise babies who are healthy, growing, and thriving. So thank you so much, Marianne, and welcome. We're thrilled to have you as our moderator.
Thank you so much, Kristen. Good evening, everyone. Another good evening, and thank you to the Bucks-Mont Collaborative for organizing this very important town hall. And as Kristen kindly said, I'm Marianne Fray, CEO for Maternity Care Coalition. And I'm not going to say anything more about Maternity Care Coalition, thanking Kelly for, Kristen for her kind introduction. So you can learn more about Maternity Care Coalition at maternitycarecoalition.org. But the most important thing is what we are going to talk about tonight. The purpose of tonight's town hall is to hear from you, the currently 157 attendees, constituents of the Montgomery Bucks area. We consider your opinions incredibly important, and we want to answer your questions and provide you with expert guidance on the county's vaccination plans. We will hear from 3 incredibly accomplished and highly respected healthcare and county government leaders, Dr. Valerie Arkoosh, Dr. Richard Lorraine, and Dr. Christopher Notte. And I will introduce them very shortly. But I want to make sure that you're clear on all of our roles tonight. My role is to keep the conversation moving and to help engage everyone in a meaningful way. And our goal together is to ensure that you have accurate and timely information to make good decisions for yourselves and your families. So let's get started. Let me begin by introducing our first panelist, Dr. Valerie Arkoosh, who is the chairwoman for the Montgomery Board of Commissioners. So Dr. Arkoosh, or Commissioner Arkoosh, was at one time the vice chair and until her election as chair in November 2016. And excuse me for not having this memorized, I had to read it. So please forgive me not looking at the camera. She was reelected in November 2019 and unanimously chosen by her 2 colleagues to again serve as chair in January 2020. And as a fellow woman, I want to congratulate Dr. Arkoosh and say, hey, hey, for Women's History Month. We are so proud of everything that you're doing. But anyway, on to the rest of your introduction. As all of you know, Montgomery County is located in Southeast Pennsylvania, and it is the 3rd most populous county in Pennsylvania, with over 830,000 residents, of which at least 172 or some portion are on the line tonight. And the 3-member Board of Commissioners oversees a budget of $430 million and directs more than 2,500 employees. The commission manages human services for more than 100,000 residents. Voter services voter services, over 130 bridges, 75 miles of roads and other infrastructure, 7 county parks, and nearly 100 miles of trails. Dr. Arkoosh is quite accomplished and must be awfully exhausted from all of that. So welcome, Dr. Arkoosh.
Thank you. It's so nice to be here with all of you this evening. I think Marianne is frozen.
Marianne, can you hear us? I think you're frozen and okay. We'll try to keep this going here. Let me, Kelly, let me just reach out to Marianne and see if I can reach her on her cell phone. And maybe we can continue.
Yeah, Kristen, if you'd like, I can go ahead and start. Oh, she's back.
Yeah. Okay, wonderful. Marianne, you're muted. Thank you.
My apologies. All right, so I better speed up because my internet is unstable. So Dr. Lorraine is the, as commander, he ensures that the detachment is organized, trained, and equipped for its vital homeland security mission of CBRN response and medical treatment. Please join me in welcoming Dr. Lorraine as well. And then finally, Dr. Christopher Notte is the Chief Medical Officer of Abington-Lansdale Hospital in Lansdale, PA. He is also Assistant Chief Medical Information Officer for Jefferson Health and Clinical Assistant Professor, Family and Community Medicine for the Thomas Jefferson University. Could we ask for a brighter and smarter panel? I am very grateful for each one of you and all the work that you're doing. And without further ado, I'd like to start the questions. The first question I'd like to direct to you, Dr. Arkoosh, and that is, the biggest question we received from people who pre-registered for tonight's event is they want to hear what's the latest on vaccine availability and timeline of the rollout. And can you explain where we are right now?
Sure. So good evening again, everyone. It's a pleasure to be here with all of you. And we are making steady progress on the vaccine rollout. It is not as fast as any of us would like, but in terms of the county's health department, we've now received over 40,000 first doses of vaccine. And across the county as a whole, over 127,000 people have either received their first dose or both doses of the vaccine. So what that means is, if you look at the people that are eligible to receive the vaccine who live in Montgomery County, and that means you have to be at least 16 years of age or older, we are now at just about 19% of those individuals have received either the first dose or both doses of the vaccine. When it comes to the county's health department, we do have a lot of people pre-registered. I am enthusiastic about how many people are eager to get vaccinated. Currently, as of this morning, we have over 185,000 people pre-registered to receive the vaccine. We opened that pre-registration on January the 12th, and we're through January the 12th in terms of offering appointments to people, and we're almost done with January the 13th. And that's a big deal because January the 13th had 30,000 people registered just on that day. And within the next day or two, I believe that everybody who registered on the 13th should have received an email offering them an appointment. I do want to urge people to make sure to check their spam folders because we are hearing that these emails occasionally are going into spam folders. And if you want to have a sense of where you are, if you remember which day you registered, you can go online to montco.org/COVID-19. And at the top of that page, there's a button that says vaccine information. Click on that, and you'll get onto the county's vaccine page. About halfway down on that page, there's a little blue flag that says status of vaccine applicants or vaccine registrants, I think it says. There's a link next to it. And that link shows you every day and how many people signed up on that day. So if you remember which day you registered, you can get some sense of how many people are ahead of you. So we are making good progress. We all wish it was faster, and we have to ask people to be patient, but we're getting there.
Thank you for that answer, Dr. Arkoosh. That was very helpful. It's very clear as well. Dr. Lorraine, many people know that Montgomery County is still vaccinating people in phase 1A. Can you explain when the county estimates it will be able to move to people in phase 1B?
Okay, I'll get to that question in a minute. I just want to kind of backtrack for a second. I think that during the first part of my, by the way, it's great to be here with all of you tonight. I really appreciate the opportunity. During my introduction, I think it was when you were frozen. So when you came in, there was just a little bit, and I don't want people to be confused as to exactly what my role is. So I am here tonight as the medical director of the Montgomery County Health Department, and I've held that position for about the last 4 years. I'm an internist who's been in private practice in Montgomery County for about 35 years as well. And the other job that I do, which was what you were alluding to when you came in at the end there, I also have a commission in the Pennsylvania Air National Guard and command a medical detachment. So having said that and reiterating, it's great to be here tonight and be able to speak to all of you and address these questions. The issue as to when the county will be able to move on to the 1B category. So Dr. Arkoosh mentioned some numbers there before, that right now we have about 185,000 people registered as individuals on our website to receive the vaccine. In addition, prior to our opening the individual registration, we also had a registration for healthcare professionals who are not aligned with particular hospitals or healthcare organizations that are immunizing. So that gave them the opportunity to be immunized as well. That was a substantial number, probably somewhere in the neighborhood of 20 to 25,000. We still have, as an estimate, somewhere around 7,000 people on that list too. So when you put that together, we're in the neighborhood of 190,000 people currently registered on our website to receive vaccine. We do think that there's a number of people who are on that list who might have gotten vaccine elsewhere. And I think we're going to address the issue of where people can get vaccine a little bit later on. So some of those may not count against the total number. In addition, there are some duplicate entries as well. So all is not lost when we look at these numbers. The other number that we look at in comparison to that is the amount of vaccine that we're getting per week. This, of course, is the rate limiting factor. Right now, we're getting on average in the neighborhood of 5,000 doses per week. So if you do some very simple arithmetic, you have 190,000 people divided by 5. That tells us theoretically when we might be out of phase 1A. Now, practically speaking, there are a couple things that are going to change that. I mentioned that the numbers don't really add up to that 190,000. It's probably significantly less than that. Plus, we've made some substantial inroads on the numbers. As Dr. Arkoosh mentioned, we are getting through the first 2 days of registration at this point. In addition, as we've noted this week, there's a new vaccine that was just approved for use. We expect production to be ramped up in the current vaccines as well. So the supply of vaccine should increase. So we do think that the rate that we will be able to immunize will go up significantly. So putting it all together, and this is purely a guesstimate on my part, I'm hopeful that we will be able to complete the 1A category and move on to 1B in roughly 2 months, 8 weeks. That's a little optimistic, but I'm an optimistic type of person. So I do think that we will be able to look forward to that.
Thank you, Dr. Lorraine. That was very helpful. This next question, it may be between you, Dr. Lorraine or Dr. Arkoosh, but I'm going to say it and then you guys can choose which which one of you are more apt to respond. Are there any plans to develop a more centralized approach to vaccine distribution? Right now, there are multiple lists, and you've both talked about it a bit, and a long vaccine provider list of providers in the county. Can you explain where people can register for the vaccine and explain the difference between the county registration list and other providers?
Yes, we'll do our best. So this is one of the vexing problems that all of our constituents are facing. The state decided from the beginning not to set up a centralized vaccine registry. So as a consequence, people do have to go from place to place and sign up. So let me explain a couple things about that. If you pre-register on the Montgomery County vaccine webpage, you're signed up with the county. And at this point, and let me be even clearer than that, you're signed up with the County Office of Public Health. And at this point, the Office of Public Health is getting about half of the doses that come into the county. So that's a pretty good place to be signed up. We're getting, just about half, some weeks probably a little more than half of all the vaccine coming into the county. Then there are pharmacies, there's a few doctors' offices, and our hospitals are also getting vaccine, and that varies from week to week. The hospitals, for the most part, aren't doing clinics for the public. Some are, in fact, Abington-Lansdale, we're so happy to work with, is one of them, but most of them are not. Although they are reaching out to their patients. So you should be looking for emails. If you're a patient at any of our Montgomery County hospitals, you could be getting an email notification that they might have a vaccine dose for you. So you should keep an eye on that. And then there's pharmacies. And right now, the pharmacies all have their own websites where you can go to sign up. A lot of people have asked the county if we could create a centralized database for the whole county. And unfortunately, we cannot. The reason is that all of these individual pharmacies are getting vaccines from the Pennsylvania Department of Health directly, or in some cases, they're getting them from the federal government directly. We at the county don't control that distribution. We don't even necessarily have knowledge of that distribution. So there's no way for us to create a centralized vaccine registry because the county health department is not in charge of where the vaccine is going in Montgomery County. So it would have to be the Pennsylvania Department of Health to set that registry up. So just to recap for people, if you signed up on the Montgomery County website, you're signed up with the county's Office of Public Health. We're running mass vaccination sites. You'll hear soon we're working to expand that. If you want to try to get vaccine at any of the retail pharmacies, you do have to go to their individual websites and sign up. We have a map that you can get to from our COVID website. And again, that site's montcopa.org/COVID-19. And there is a provider map near the top of that page. That information gets pulled from the Pennsylvania Department of Health. So you can click on that, goes to a map, and you'll see a whole bunch of blue dots, and that's every provider in the Commonwealth that's been approved to have vaccine. And if you click on one of the dots, it will tell you if they've received vaccine in the last week or last couple weeks, and then there should be a website, and you can go to that website and sign up. It's complicated. It requires a lot of patience.
And thank you. You actually tipped off the next question, which was, are there plans for additional mass vaccination sites? I mean, you talked a little bit about that, but are there any plans?
Yeah, I'll let Dr. Lorraine address that.
Okay.
Yeah, so certainly we want to be prepared. As I mentioned, we are expecting an increase in the vaccine flow as time goes on. So we want to be prepared for that. And we want to have our plans in place, ready to go as soon as we get more vaccine so that we can give more vaccine. Right now, we're running two sites, at Montgomery County Community College and Norristown Area High School. We've got some firming up plans at this point to open a third site in Willow Grove in the near future. This, of course, is predicated upon getting more vaccine. But we have the site located, the site work is being done, and we are prepared to move forward with that as soon as we have the vaccine. Expecting that, again, the flow of vaccine is going to increase, we're also looking at other sites across the county. We have a couple in the western part of the county that we're looking at as well, potentially going forward, looking at a very large distribution site. So right now, the population that we're doing is still somewhat limited. It's the 1A population, meaning older people, people with specific medical conditions, healthcare providers. We'll be moving on to the essential worker population as well. Once we pass that, we are then getting into the general population. That would be phase 2. And that's where we have to be really prepared to run a mass vaccination operation. So we want to have all of these sites available, ready to go, and staffed so that we are prepared for when that vaccine flow does increase.
Thank you, Dr. Lorraine. I'm throwing it back to you, Dr. Arkoosh, and don't worry, Dr. Notte, you're coming up soon. You know, a few people, Dr. Arkoosh, referenced an article in the Philadelphia Inquirer that stated that Monco and other suburban counties are not getting their fair share of vaccine. What is your response to that? And have you raised this issue with state officials? You're on mute.
Thanks. It's been a very frustrating situation from the early days. We have never felt like we were getting enough vaccine for our population of 830,000 people. Now, not all of them are eligible because some of them are children, but we are the third largest county in the Commonwealth. And I've been raising this issue for weeks, both publicly in our press briefings and also with Department of Health officials, with the secretary, the prior secretary, the current secretary. So this has been a well-discussed topic. There is a scheduled meeting tomorrow with the Department of Health with the 4 counties. By the way, it's very important that people understand that Philadelphia is a separate entity in this. They get their vaccine directly from the federal government. It's a historic situation. They've always gotten their flu vaccines and everything else in a different way than the other 66 counties in the Commonwealth. So they're not part of this discussion. But the other 4 suburban counties, Bucks, Mont, Chester, Delco, we are meeting with the Department of Health tomorrow, and they have promised that they would share additional data with us and give us some more insight into how they are making these vaccine allocation decisions. But on the surface of it, it appears that we aren't getting nearly as much vaccine as we should be, at least relative to other counties that are much smaller than us. And in Montgomery County's case, we have the second highest number of licensed long-term care facilities in the state, second to Allegheny. And so right there alone, we should be getting a lot more vaccine than we are coming into this county. So it has been frustrating. Those 185,000 people that have been waiting in line now for a very long time are even more frustrated. And hopefully tomorrow we'll get some clear answers about what's to come next.
Well, thank you for fighting for us. Dr. Lorraine, what happens if you do not get the second vaccination on time?
Okay, so that's a very, very timely question because there's been a lot of publicity about issues with delays in the second dose in the Commonwealth. In some cases due to some misappropriation of the first dose and the second dose by some of the private organizations giving out the vaccine. The good news is that there's some very, very good data that came out recently, which indicated that both of the currently used vaccines, the Mrna and the Pfizer, can be given later than their original information stated. The Pfizer vaccine, the booster dose is supposed to be given at day 21, and with the Moderna, it's supposed to be given at day 28. But the data that's come out recently has said that that day can be delayed to up to day 42 for both of those vaccines without any decrease in efficacy whatsoever. And I would point out that After day 42, we just don't know what would happen. It's not that the efficacy rate would necessarily fall off. We just don't have the data at this point. So in a lot of cases where people have gotten their first doses, they're being told that their second dose is somewhat questionable. There's actually a lot of misinformation going out about that too. Most of the private organizations are giving the information that they don't know when they're going to be able to schedule that second dose. And that simply has to do with the delivery mechanism from the state. They're using something called a smoothing method to be able to equalize the doses. So it's ending up delaying these second doses for 1 to 2 weeks, but it's still going to be coming out. The state still will be authorizing the release of the second dose for anyone who got the first dose. So you may be contacted by the place that you got your vaccine, or in the case of the county, we would discuss that with you. And it may be a delay of 1 to 2 weeks past the time when you thought that you would be getting it. We've been very, very fortunate at the county that we have gotten our second doses on time, and we have a very good system for making sure that that's delivered. So we have not had to delay anyone for a second dose. Now, that said, some people have come into individual circumstances where it's been necessary for them not to get it at the particular time that they were due. We've had some people who, for example, had been exposed to COVID in the interim and had to quarantine past the time when they were supposed to get their second dose. We have developed a mechanism to help those people get their second dose, even though it's not exactly at the time when they were due. And again, if it's up to day 42, we expect absolutely no decrease in the efficacy. In certain cases, if it's after day 42, it's still quite likely to be very, very efficacious. The bottom line is that the second dose should always be given. Even if there has been some delay, we should still give that second dose. We do not need to restart the series either.
Thank you, Dr. Lorraine. So Dr. Notte, you're on finally. I understand, and I don't see you, are you? Just want to make sure you're on. Okay, you're there.
He's there.
Perfect. I understand the vaccines have not been tested on folks with autoimmune disorders or pregnant women. What is your recommendation for people in these categories or others with pre-existing conditions?
Yeah, so great question. I think that we are really fortunate because what we have seen from the millions of doses that we have given so far of these vaccines is that they are incredibly safe. So while, you know, the data obviously are limited from the studies because this was done in a very expeditious fashion in order to get the vaccine out as quickly as we can, we have the sort of the lens of some hindsight now to show that the vaccines that we are giving are incredibly safe. I would strongly recommend that those with pre-existing conditions, including those who may be immunocompromised, get the vaccine, you know, if they are in the correct category as soon as they can. I also think in the case of pregnant women, you know, there's been a lot of press about this. The World Health Organization came out with some controversial recommendations and things like that. You know, the CDC would say that, you know, obviously this is a discussion that a pregnant woman would want to have with her obstetrician, but ACOG, which is the American College of Obstetrics and Gynecology, has been very clear, as have other U.S. guideline making organizations, that pregnant women should get the COVID-19 vaccine when they can. You know, certainly being pregnant puts you at increased risk if you were to get sick with COVID-19. So I would encourage all pregnant women to get the vaccine if available. And, you know, I think it's probably the best thing we can do. And frankly, there are very few people that I would suggest not get the vaccine. There have been one-off situations where people have asked me and I said, listen, talk to your doctor. If you have a specific situation, you should speak to them. But, you know, unless you have a known allergy to some component of the vaccine, I would strongly recommend that everyone get the vaccine.
Thank you, doctor. And another question for you. Mm-hmm. How long does the vaccine last? And will it be required every year?
Man, if I could answer that question, I'd be on every national news station probably. You know, the frank truth is we don't know. So I've actually spoken to several vaccinologists who are experts in this area, and I've gotten a variety of answers. Some have said, you know, we believe it might last a few years. Others have said, you know, it could last longer, and some have said it could last shorter. The good news is that the vaccines are incredibly efficacious. All three of the vaccines that are currently approved for use in the US are among some of the most efficacious vaccines we've ever made for any condition. So I am incredibly encouraged that those vaccines are as effective as they are. And so I think the best I could say is we have to wait and see. But, you know, one thing I'm very hopeful for is that if we do need to do this annually or on a regular basis, that because we'll have a little bit more time to prepare, you know, I think it'll be a lot more, you know, kind of streamlined in the future to get folks vaccinated. So I think this year's the hardest, and, you know, we got to get out of the gate, and we'll see what happens.
Thank you. You know, we're hearing a lot, and this is for any panel, and any three of you. We're hearing a lot about the new variants. You know, the UK, the South African, the Brazilian, like there's just, it seems like the information keeps on coming. And can you provide information about the variants and the vaccine's ability to protect from them? So for any of the three of you.
I'll go ahead and jump in then. So yes, we are hearing about these new variants popping up. It is expected. You know, this happens with all viruses. There's always changes, mutations, and variations. There's a difference in terms of the genetic material. There's also a difference sometimes in terms of the external proteins. What we've seen to this point is that the vaccines do retain significant efficacy against the variants. Now, are they completely efficacious? We have yet to see about that. But one of the really good things about the particular types of vaccines that have come out now is that they're relatively easy to change. The Moderna, the Pfizer vaccine, are something called mRNA vaccines. And I liken that to basically an instruction. So the vaccine provides an instruction into the cell to produce a protein that's very similar to the spike protein on the virus. And once that protein is produced, the body's immunologic mechanism recognizes that and produces antibodies to it. That's the mechanism for protection. So it's very, very easy with this particular type of vaccine to change that instruction sheet, if necessary, to modify it to the new variant. So that's one very, very hopeful thing going forward. For the most part, what we've seen from these variants is not that they're particularly more virulent than the original strain. That means that it makes people sicker or makes people die more often, but they are a little bit easier to transmit. So again, we're hopeful that using the vaccine, developing to the point of herd immunity, where enough people are vaccinated, it's very difficult to transmit the virus, will be able to interrupt the transmission and really make a difference in the long run.
Thank you. Another question, and I don't know if this would be you, Dr. Arkoosh, but this week the governor relaxed some of the limits on social gatherings and removed the travel ban. When do you expect things will start to get back to normal?
Well, we got a ways to go before we're going to be back to normal. So I think what's important to remind everyone, particularly while we are all waiting, so many of us are waiting still to be vaccinated, is that the mitigation measures that we've been practicing work. And what I mean by that is wearing a mask properly with your nose and mouth covered, watching your social distancing, keeping that 6 feet of distance, keeping those hands clean and away from your face. Those things really work well. They're not 100%, but they're pretty close. So we all need to keep doing that. And the governor did relax some of the occupancy limits, but I don't want people to think that, you know, they can just do whatever. Now an indoor venue is allowed to be at 15% of capacity, and an outdoor venue I think can be at 20 or 50% of capacity. So it's not like everything's back open 100%. So given the rate at which the vaccine is coming, you know, if we are fortunate and nothing goes wrong along the way, and all of the doses that the Biden administration have procured end up being manufactured on time, because remember, these doses, a lot of them haven't even been made yet. They get manufactured on time, they get shipped on time, we get them. By the summer, you know, by the early to mid-summer, I would imagine that we'll be moving pretty far into that general population of people that we should be through most of our 1A, 1B, 1C folks, and really getting a chunk of the general population vaccinated. The goal is to get something called herd immunity. And what that means is that enough people in a community are vaccinated so that the virus has nowhere to go. The only way the virus can survive is to go from one human to another human who is susceptible to the virus. That's why the masks and the social distancing and the hand washing work so well, because it keeps that virus from getting to the next human. And herd immunity means that so many people are vaccinated that the virus just can't find someone who it can infect, and so it dies. So the best guess for where we need to be is about 75 to 80% of folks vaccinated in order to reach that herd immunity. So it's going to take a while for us to get there. It would certainly be sometime into the summer. Perhaps it might take most of the summer. And I also just have to remind people here that we don't have the vaccine approved yet for our children. So the youngest that you can go down to with only one of the vaccines, and that's the Pfizer vaccine, is age 16. The J&J and the Moderna vaccines are only approved for people that are 18 and older. Now, studies are currently underway down to 12-year-olds, but it will take time to get those studies done and to analyze the data. So as much as you want to, don't throw away those masks yet. We are going to need them for a bit longer.
Thank you so much. And I know I froze a little bit during that, your response. So I think that the last question has been, you sort of answered it already, Dr. Arkoosh, and it really is time to actually try and get some questions from the audience right now. And then I'm going to ask, as you answer those questions, that each one of you think about what is one thing you want the audience, these, you know, nearly 190 constituents, to know that's really important from your point of view. So that will be like the last question that I ask each one of you. But to start with a question that was shared in the audience is, with the approval of a third vaccine, how long do you suspect before we see more widespread access? Do you think the J&J vaccine will be more widely available to primary care practices in the near future? And this is a question for Dr. Lorraine.
So that's really a wide open question at this point. Right now, there's actually some plans for the use of the Johnson & Johnson vaccine initially to direct it actually towards our teachers and our educational workers to try and get them vaccinated so that we can feel more comfortable in fully reopening our schools. The important thing to mention, by the way, about the Johnson & Johnson vaccine is, unlike the Moderna and the Pfizer, it is a one-dose vaccine. The Moderna and the Pfizer, obviously, as we discussed, are 2 doses. So that makes things a whole lot easier in terms of the logistics for it. So we're looking at using that particular vaccine, certainly for the educational worker population, the teachers, but sometimes also other populations that might be a little bit more difficult for us to get to. People who might be homebound, people with limited access to medical care. It's much easier to be able to give them a vaccine that they only need to get one time. It's very, very much dependent, like the current vaccines that are available, are on the availability and the manufacturing. So we really have to see what happens in terms of that manufacturing process. We have heard, and I do believe that this was confirmed, that Johnson & Johnson has entered into a partnership with Merck to utilize some of their manufacturing capability to be able to increase the amount of doses of that vaccine. That's going to be really, really helpful in trying to get that out as well. Once more vaccine in general is available, I do believe that the plans are to, again, increase the flow of vaccine to other providers. I've experienced this also as a private medical provider. I've had limited amount of vaccine available in my office. But we do hope that as that flow increases, that the amount can be increased to individual medical practices. And it's my belief on that side that that's the place where a lot of people can go, particularly those who are at higher risk, to get their vaccine within the comfort and the individual relationship with their primary care physician if they have one. We're doing a great job of it within the county, but there are limitations when you are working with a mass operation and everything kind of gets lumped together to a certain point. So if we look at this as a full cooperation between the medical establishment, the private medical offices, the public health establishment, all of these entities can be brought to bear to fully address what we need to accomplish.
I so agree with you, Dr. Lorraine. I think when you see this kind of intersection, this marriage between private partners and public health officials, that's what allowed us to get to this point as quickly. And it usually is collaboration that allows us to do amazing things. And I think it is incredible that Johnson & Johnson is working with Merck, or the two of working together as competitors. I think that that really shows how important it is to prioritize public health over profit. So the next question that I have, I think it's from the audience, and I think it would be perhaps to you, Dr. Notte, is, does the vaccine affect anything dealing with fertility? So if a woman is interested in getting pregnant in the near future, should she be concerned about the vaccine?
Well, again, I mean, we don't know for sure, right? That's one of those things that, you know, only long-term data will tell us. But the reality is there's really no contraindication. So there's no reason to delay getting vaccinated. If you understand the way that vaccines work, they sort of get our immune system to do something, and that is produce antibodies. And they've been doing this for years. There's really nothing new about what we're doing with COVID vaccinations that we weren't doing before. We are getting the immune system to produce antibodies to a virus. And, you know, yes, we're using new technology, which is incredibly exciting and I think very safe. But it's something we've been doing for a long time. So I don't think there's any reason to believe that folks who are wanting to get pregnant should delay in getting the vaccine if they're in the correct category to do so.
Thank you. And this question can be for any of you. Can vaccinated individuals contract the virus and, while not becoming ill, transmit it to others?
I'll enjoy taking that one because that's an easy answer. The answer is no. Plain and simple, no. It is impossible to contract the disease from the vaccine. So I'm going to go back to my analogy of the two vaccines that we've been using to this point. They provide something called messenger RNA, which is basically an instruction book that goes into the cell where the cell starts producing proteins. And it tells the cell organelle to produce a protein that looks like the spike protein on the outside of the COVID virus. So not only is there no genetic material, no original material at all from the COVID virus, there's actually nothing that relates directly to the COVID virus. This is an instruction book that says to produce a similar protein. So it is absolutely impossible to get the disease from the vaccine. Having said that, there are some side effects to the vaccine. They are fairly common, and we should address that too because some people are afraid of the side effects. My point is always everything has side effects. What we always look at is, do the benefits of the vaccine outweigh the risk of the vaccine? Do the side effects outweigh the actual effects? And the answer, of course, in this case is no. What we do see is basically a viral type syndrome is fairly common. So people might feel a little feverish, a little bit of chills, a little bit of aches, some fatigue. And that would last for 24 to 48 hours in most cases. And then it resolves. The experts tell us that that is a sign that the body's immune system is functioning to produce this protein, recognize this protein, and produce the antibodies against it. So we always encourage people to say, hey, if you feel that, that means it's working. That, of course, then begs the question, if people don't have the side effect, is it not working? But the answer is no, it's working either way. So it's worth getting the vaccine. The side effects are tolerable in most cases, and they are relatively short-lived, and the benefit that you get is quite significant.
Marianne, if I could just jump in on that. One way to think about this is the vaccine is not injecting the virus into our bodies. It's injecting a set of instructions on how to make antibodies to fight the virus. And when people have a reaction to the vaccine, it's just that their body's reading the instructions carefully and having a really robust response to it. So there is no vaccine being injected. It's really almost just like an instruction sheet on how to teach our cells to make the antibodies that will fight the virus.
You know, that is incredibly helpful. I mean, I myself have concerns, and so when I hear you describe it as an instruction sheet, that is something that I will share with my team and my family, because it is a legitimate, it's a fear. So I appreciate the information. Yeah. This is, I think, a really good question that I have, and then I'm going to wrap it up after this, is for folks that are unable to get to vaccination sites. They might be, blind, deaf, disabled. Are there any plans to assist them with getting vaccinated?
Yeah, so we are just this week starting a mobile vaccine effort, and that is starting at a number of congregate housing for our seniors that are in vulnerable communities that do not have really a good way to get to a mass vaccination site, or because of physical limitations would have difficulty going to a mass vaccination site. So our team visited the first site today. They're visiting another site on Friday. We're going to learn from these 2 visits and then hopefully get pretty efficient at doing this and start going to a number of places. We've also worked in wonderful partnership with our hospitals, and Abington has been fantastic, working with the county to help reach groups of individuals that are high priority, that are in that 1A category, but for a variety of reasons would have difficulty getting in to a mass vaccination site. We've also worked with organizations like the Black Doctors. They did an event recently, or they're actually setting one up soon at one of our churches. There's been another hospital that's done a church event. Once we get through these high priority elderly congregate living areas, we will also be looking to go more into neighborhoods and into places of worship. And we have already a big list of places that have volunteered to be one of those places. So none of that's going to happen this month, but as we get more vaccine and we are better able to do this very efficiently, we are looking at a regular mobile clinic kind of, we have a 28-day cycle. So we start at the first place, go for 28 days, and then on the 29th day, we go back to the first place for that second dose, right? We have to always be thinking about that second dose. So we're working on all of that. And I don't know actually if we mentioned it, that you can register by phone now. Did we get that phone number up? Maybe if you wouldn't mind, Marianne, we can just quickly put that graphic up. I think Kelly has it. And we do want to make sure that everybody knows that you do not need internet access or an email in order to pre-register with Montgomery County to receive vaccine. And we have a hotline number, which is 833-875-3967. And I think Kelly's putting that up. There we go. 833-875-3967. 875-3967. And if you call that number between 8 and 4 p.m., and just let them know that you need help to pre-register by phone, they'll transfer you over to a whole team of people that can help you with that. There's also language line available at that number. So you can choose any language that you're most comfortable using in order to convey that information. So we just want to make sure that that service, everyone knows that service is available to them.
That's wonderful. Thank you, Kelly. And thank you, Dr. Arkoosh. We are coming into the last 10 minutes of our time together, and I really think we want to really hear one more thing from each one of you that you think would be very useful for your constituents to hear that maybe we haven't covered. It's just your opportunity, and I'd ask, 2 minutes, 1 to 2 minutes each, if you could just kindly leave some words of wisdom. This has been incredibly insightful to me, and I'm hopeful that through all of the answers that you've given, people can go home, talk with their medical providers, and be informed and make the best decision for themselves and for all of us. So can I ask you to start, Dr. Lorraine?
Well, it's hard to limit it to only one thing, but feel free to stop me if I run too long.
I'll give you two.
Two, I appreciate that. Okay, so the first thing actually I wanted to address is a question that I did see pop up. So I think it's an important thing to address. The question that someone asked was, how long after you receive the vaccine, it was particularly the Pfizer vaccine, I believe, do you develop immunity? So it's pretty much the same for both of them that are available now. Once you get your first dose, in about 2 or 3 weeks, you are somewhere at about 50% efficacy. You get the second dose at the roughly 4-week period. At 2 weeks after that, at week 6, is when it has hit its peak efficacy, and that's generally around 90 to 95%. As Dr. Arkoosh mentioned, that should not really let you think that that's where you let your guard down, because we still have a lot of other people in the community who have not yet been vaccinated. We still have a fairly high prevalence of the vaccine, of the virus in the community. So you still want to continue with those precautions. We are looking forward to a point down the road where we do reach that herd immunity, where we can start to relax things a little bit. And that is not all that far off. So the main point that I want to make is that everyone should have hope that we are going to return to where we were before. We will be able to get together. We will be able to have gatherings. We will be able to go to concerts. We will be able to see our families. We will be able to travel. And this vaccination program is a huge step along the way. So be patient with us. We are working as quickly, as efficiently, as expeditiously, and as equitably as we can to provide this service. Recognize that there are other sources of immunization as well within the county. We're not the only game in town. We try to be the best, but we're not the only game. So utilize all of those resources, and please, please be assured that this vaccine is safe. It is effective. It is very useful. Even though it was developed very quickly, there were not shortcuts taken that compromise safety in any way. I would strongly encourage everyone who is eligible to go ahead and get vaccinated.
Thank you, Dr. Lorraine. Dr. Notte?
Well, first of all, I want to say thank you for inviting me to be part of this incredible group of folks. It's truly an honor. I've been working with Dr. Arkoosh for some time now throughout the COVID pandemic, and I can tell you that her commitment to this county and to getting folks vaccinated is pretty incredible. She's definitely put herself out there. I'm sure Dr. Lorraine has as well, and kind of advocating with our state. I don't think she gets the credit for that nearly enough. So thank you, Val. Thank you, Rich. I wanted to say a couple things. One, in response to the questions in the chat, I know that Val answered briefly to one of the questions. I think one of the questions earlier had to do with, if you get vaccinated, are you fully protected? Can you give it to somebody else? And the answer is that none of these vaccines are 100% effective, right? We've been talking about that this evening, 95%. I think the J&J one, they claim about 70 some percent, but there's a couple of key pieces of information I want to point out. First of all, almost all of them, even if you get the virus after getting vaccinated, reduce your symptomatology and keep you out of the hospital. So there's incredible benefit. And this is how the flu shot works as well, right? We don't give people the flu shot because we think it's going to completely prevent the flu from everyone that gets it. We give it because it reduces the symptoms if you do get the flu, and it keeps other people around you safe. We don't fully know if you being vaccinated protects others around you from getting sick. In other words, can you transmit it still? We don't know that for sure, but in all likelihood, just like with the flu shot, it probably does. So I think we should be really, really encouraged to get the vaccine and not hesitate. And finally, I just wanted to say that, I get tons and tons of questions about, when can I get the vaccine? When should I get the vaccine? I know that everyone on this call is committed to working as quickly as we can. I know we at Abington are as committed as we can possibly be to getting this out as quickly as possible. I'd encourage everybody to register, to get it when you can, when it's appropriate, to please be respectful to others. And if you've had COVID, and you've survived and you've done okay, that's a great benefit. You've got at least probably 90 days of kind of immunity and maybe longer. So I think that will go a long way as well to producing that herd immunity that we're talking about. So I'm really encouraged that things are moving along very, very quickly. We have never done anything like this before. And the last thing I will say is, there are a few good things that have come out of masking and social distancing. Val and I were talking last week about the numbers. Last year at the end of January, the CDC estimated there were like 13 million cases of the flu in our country. And the flu is an incredibly deadly illness, kills so many people every year, except this one. This year, we only think we've had about 1,300 to 1,400 cases of the flu across the whole country. So masking and social distancing work. Keep yourself safe. And do everything you possibly can to keep up those precautions until we're out of the woods. And thank you so much for having me as part of this discussion.
Thank you, Dr. Notte. And so Dr. Arkoosh.
I get the last word, or the next to the last word. So I just want to thank you, everyone, for organizing this, for my colleagues for joining us tonight. I'm so fortunate to work with Dr. Lorraine and Dr. Notte. You can just, I hope, understand how hard we're all working together and really trying to make sure every single dose gets used. So thank you for investing your time with us tonight. And I know probably even after this discussion, there's still some people that are hesitant about this vaccine. And I just want to remind you about this. Every one of these decisions is a decision about how much risk you want to put yourself into or someone in your family into. And every week I do give a press briefing. Every Wednesday at 1:30, it's what streams live on Facebook if you want to watch. And every week, just about every single week, I have to share that some number of residents from Montgomery County have died due to COVID-19. We are well over 1,200 people have died from COVID-19 in the last year. And by the way, our year anniversary is this Sunday, March the 7th. That's when we got our first cases of COVID in this county. And I'll be honest with you, I'm really tired of that. And so if you're still hesitant about getting this vaccine, remember that we know two things. We know that COVID absolutely kills people. We know that with certainty, and it has killed a lot of people in this county, and it's killed over 500,000 people in this country. And we also know that these 3 vaccines are 100% effective against hospitalization and death. So we've got the absolute possibility of death from getting COVID, and we have as yet kind of undefined possibility of some long-term disease, or at least, several weeks to months before people just don't feel right. Weigh that against the vaccine, three vaccines that have not killed anyone. There's not been any deaths in these trials, and they have protected 100% against death. So I so respect that these are difficult decisions, and every one of them is personal, and everyone should talk to their trusted healthcare providers. But please just remember what we're weighing here. And the sooner that more people are vaccinated, as we continue to get vaccine, the quicker our kids can all get back in school, our economy can get back on its feet, and we can see our friends again. So just learn about it and really think thoughtfully and carefully about it, because it's going to take all of us working together to keep our community safe.
Thank you so much, Dr. Arkoosh. And I see that we are at our time. And so I just want to thank everyone and then remind us that we are accountable to one another and to our community. So let's listen and let's act. So thank you very much. And I will turn it back over to Kelly, or is it Kristen? To close out the session.
You said it beautifully. So thank you to all for sharing time and wisdom tonight and counsel. And just we're so thankful that we could all gather tonight to share accurate information and to engage our community in this conversation. So thank you very much.
Thank you. We appreciate the opportunity.
Good night, everybody. Thank you.
Good night. All right. Stay safe, everyone.
Thank you.